Anyong, we are the Group 9, Ernel D. Bagbag, Amethyst P. Martinez, and Giselle B. Ramos. Today we're going to discuss to you a research paper entitled Meta-Analysis of Metabolic Syndrome and its Individual Components with Risk of Atrial Fibrillation in Different Populations. This paper was published in the BMC Cardiovascular Disorder 2021 by Zheng et al. For the outline of our discussion, I'm going to introduce to you the topic, and Sir Ernel will do the methods, while the results in the discussion will be presented by Ma'am Amethyst. So what is atrial fibrillation, or AF? It is a common arrhythmia with an estimated 33.3 million affected people in the world in 2015. The prevalence of AF in people over the age of 60 is estimated to increase from 3.9 million to 9 million by 2050. By the way, arrhythmia is a problem with the heart rate and rhythm of heartbeat. The heart can beat too fast, or it's referred to as tachycardia, or too slow, bradycardia, or with irregular rhythm. And atrial fibrillation is a condition wherein there is irregular and often rapid heart rate that occurs when the two upper chambers of the heart experience chaotic electrical signals. Metabolic syndrome, on the other hand, is a constellation of conditions that include obesity, dyslipidemia, hypertension, and insulin resistance. MetS have been recognized as a risk factor for cardiovascular morbidity and is likely related to the epidemic of cardiovascular diseases. The prevalence of atrial fibrillation increases in parallel with the frequency of MetS, and various components of MetS have been known to have a role in the pathogenesis of atrial fibrillation. With the conglomeration of components seen in the metabolic syndrome, the risk for atrial fibrillation increases greatly. And recent studies have suggested that the effects of metabolic syndrome and its components on atrial fibrillation, but the results remain controversial. Therefore, the authors performed a meta-analysis in order to evaluate the relationship between MetS and the atrial fibrillation risk. The American Heart Association and the National Heart, Lung, and Blood Institute defined the metabolic syndrome as the presence of at least 3 of the following criteria: waist circumference of greater or equal to 40 inches for males or 35 inches in females, triglycerides greater than or equal to 150 mg per dl or on drug treatment for elevated triglycerides, HDL cholesterol of less than 40 mg per dl for males or 50 mg per dl for females, or those on drug treatment for reduced HDL. Systolic blood pressure must be greater than or equal to 130 mmHg, or diastolic blood pressure of greater than or equal to 85 mmHg, or those on anti-hypertensive drug treatment with history of hypertension. Fasting glucose, which is greater than or equal to 100 mg per dl or on drug treatment for elevated glucose. Why could MetS lead to AF? Several studies shown that MetS components together may have an additive effect on the risk for AF, and the pathogenesis of AF involves very complex interplay of AF triggers and abnormal atrial substrate to sustain the arrhythmia. MetS components may also act as risk factors by their effect on the atrial fibrillation triggers or the atrial substrate. Thus, various components of MetS have known to act in a synergistic manner, and the final common pathway in the atrial fibrillation pathogenesis are the following. First, the atrial structural and electrical remodeling. Second, those inflammatory processes, and the cardiac autonomic changes occurs in the body. For the methods, we're going to hear from Sir Ernel.
So hello everyone. So I will discuss to you the methods in the article. So basically the focus of the methods that was used in the article is meta-analysis. So what is meta-analysis? So when we say meta-analysis, this is the statistical analysis in which it studies all of the results from multiple scientific articles. So in the study, the authors use this what we call the meta-analysis of observational studies in epidemiology or MOE, which can be summarized in these three areas, which are the eligibility of criteria, literature research, data extraction, and statistical analysis. So first is this eligibility of criteria. So the authors evaluate the different effects of metabolic syndrome and its components to atrial fibrillation. So it is followed also the adjusted hazard ratios and the corresponding 95 confidence interval. So the authors must seek for the articles in which it evaluates the effects and has the HR and 95 confidence interval as their effect size, or the measures in which this study are whether it has an effect or not. Okay, this next is the literature research in which the authors gathered all of the necessary articles in the study, including the study, on the Cochrane Library, PubMed, and InBase. So basically, this is the flow in which the authors they gathered from 237 research articles. They deducted that one into 6 based on the criteria search. The next one is the data extraction. So the authors gathered the author's name, publication, diagnostic criteria of metabolic syndrome, outcome, and the effect size, which is the adjusted health ratios with 95% confidence interval. The next one is the statistical analysis. So the authors first gathered information and to identify the prevalence of atrial fibrillation or AF with metabolic syndrome and without metabolic syndrome. So basically, they compared these two. Next one is they calculated the risk estimates and confidence interval as a whole, and by producing this what we call as forest plot. So forest plot is mainly the main output of the meta-analysis, which can be done by Revman Manager 5.3 software. So in order for us to understand the results, I will explain to you what are the components of the forest plot. So first is the study or the subgroup area. So the first column, we can see the different individual studies that were collected based on the criteria that was set by the authors. Then this is followed by this what we call as the hazard ratio, in which they applied logarithm formula in order to naturalize all these values. And it is also noted here the standard error of this effect size. The next one is the weight, in which it measures the influence of each study. As you can see, the study of CLO 2019 has the greater influence of the study among all of these study in the area. The next one is the hazard ratio. So the hazard ratio and the 95% confidence interval can be graphically represented here in this area. So as you can see, this value, the 1.40 values, is the effect size, which is designated by this red color. And the larger the area or the square here represents the larger weight or the influence of the study. So as you can see, all of this graphical representation, this one by Cho 2019 has the greatest area of square, which denotes the highest influence. So basically, this is the graphical representation of these values that are located here. Next is the line null of effect, in which this line of effect is in which those confidence interval that passes through this line of effect designates whether it has significant difference or doesn't have significant difference. So as you can see, these 4 studies possess significant effect or significant difference, while this study doesn't have this significant difference because the confidence interval passes through this line of effect. The next one is the information here when all of the studies are pulled together. So this is the total 95% confidence interval, the total weight, and the hazard ratio, and the random 95% confidence interval. It is then represented by this area. Actually, this is diamond. So as if the results will be presented later on, you can see that this area here is represented by a diamond. So if the diamond is big, then it has the greater amount of weight because it is pulled together. The last information here is the heterogeneity and the test of overall effect. So as you can see, we have 3 measures of the heterogeneity, the tau squared, the chi-squared, and the I-squared. But here, the study uses the I-squared, in which if the value obtains less than or greater than or equal to 25%, it denotes low heterogeneity. If it is greater than 50%, it denotes moderate, and 75% it is high. So when we talk about heterogeneity, it means that this study has the tendency that they are the same. So if the value is closer to 0, then your study or your meta-analysis is good. Now, as you can see, the value is 0% or the I2 is 0%, meaning the meta-analysis is good to be interpreted. Okay, so that's all for the forest plot. I hope you learn a lot in my report. Thank you, and thanks.
Thank you, Sir Arnel. Now, my task to you is to present the results and discussion of our study. As you can see here, we have the Table 1. Table 1 is the summary of included studies in this meta-analysis. The study from June 2019 showed the highest atrial fibrillation rate result, which is 0.98%. Now, the study also included population from Korean, American, Socomer, and Japanese. And with the total case, if we sum this all up, it will give us 30.8 million patients. And this for the patients that were analyzed, including 7.5 million cases of MetS. Now, I will discuss to you 6 studies for analysis of atrial fibrillation, MetS with AF risk, and also the association of individual components of MetS with AF risk. These are the components: abdominal obesity, elevated blood pressure, elevated fasting glucose, low HDL cholesterol, and high triglyceride. For MetS with AF risk result, as you can see here in figure 2, meta-analysis showed that patients with MetS were at increased risk of atrial fibrillation as compared with those without MetS, with significant heterogeneity of 97%. I-square is really not that big, so meta-analysis is really not good to be interpreted. And as you can see here, this is the controversial interval, the total controversial interval. As Sir Ernel have discussed, it showed already a diamond result. Now, for abdominal obesity, the risk of AF or atrial fibrillation was elevated in patients with abdominal obesity as compared to those without abdominal obesity, with little heterogeneity of 0%, as you can see here in figure 3. Also, it is quite worth noting that according to abdominal obesity, when it was analyzed in various populations, normal, obese, overweight, the results showed that abdominal obesity could not be proved to have a higher risk. So the meta-analysis is quite good to be interpreted since it is 0. Now, for elevated blood pressure, we have AF was elevated as well in patients with elevated blood pressure compared with those without elevated blood pressure, with just moderate heterogeneity of 71%. All of the study also passes the null of line effect. Also here, fourth one, elevated fasting glucose. So the risk of AF was elevated in patients with elevated fasting glucose compared with those without elevated fasting glucose, with low heterogeneity of 25%. So as you can see, the difference here, as you can see, CHO from 2019 still has the highest weight result, with the I-square of 25%. So this meta-analysis is good to be interpreted. Now for the fifth one, low HDL cholesterol, the risk of AF or atrial fibrillation was elevated in patients with low HDL cholesterol compared with those without low HDL cholesterol, with significant heterogeneity of 87%. As you can see, it's quite big, but everyone, all of the study passes the null of line effect as well. So for the sixth one, we have the high triglyceride. The risk was not elevated in patients with high triglyceride compared with those without high triglyceride, with significant heterogeneity of 91%. As you can see here, it didn't pass the line of null effect. And for the discussion, those were the results for the discussion. Meta-analysis showed that patients with MATS were at an increased risk of AF or atrial fibrillation as compared with those without MATS. For the components of MATS, we have the abdominal obesity. These are the components: elevated blood pressure, elevated fasting glucose, and low HDL cholesterol. They were associated with an increase in the risk of atrial fibrillation. While the analysis showed a significant different result for the effect of triglycerides, high triglycerides. Implications we have, it means that the study results show MATS and its components have significant influence on occurrence of atrial fibrillation. And the control of MATS and its components may have an effective effect on reducing the prevalence of atrial fibrillation. It is very important for us to know these results since this could reduce the prevalence of atrial fibrillation. So in conclusion, we have the present study of meta-analysis suggested that MATS as well as its components including abdominal obesity, elevated blood pressure, elevated fasting glucose, and low HDL cholesterol were associated with an increased risk of atrial fibrillation. So that's all for our presentation for today. Thank you so much for listening. And if you have any questions, we have, or you can visit our references, which is presented as well. This may answer your questions. So that's it.